The Asheville project in Asheville is the perfect example of what they've been able to do. The Asheville project has been going on since 1997, and here's what they said. They took their employees and they said, we have a huge amount, our health insurance continues to increase. And we looked at the actuarial data and said that those with diabetes are costing us the most money. That's costing us not as a company, but as a city, it's costing them the most money. So how can we lower those healthcare costs in the highest cost that we're having to pay for? So what they did is they put together a disease management program that basically says this: if you will participate in our disease management program, we will pay for all your meds, your strips, your co-pays, anything related to you going to the doctor, we will pay for those. But here's what I want you to do. I want you to participate in our program you'll go to the doctor when the doctor's asked for you to come for a routine visit, get your routine checkups done. You'll meet with your pharmacist to make sure that you're taking your drugs correctly. Remember, 50% of the people that get their prescriptions don't even get them filled. And 30% of the people who do get them filled take them incorrectly. Meet with a physical therapist, and we're going to pay for this for you. Meet with a dietitian. And here's what they saw after first year. They saw a 95% satisfaction rate. They saw a 50% drop in absenteeism. So that meant what happened in the workforce. Production went up. The cost savings per participant was an average of $600 per person. At the end of 10 years, the cost per year savings for that population from the company standpoint, or the city in this case, was $3,600. At the end of 10 years, they looked at all their actuarial data, and they established that those who were on the program cost them the exact same amount of money, and they had a disease, diabetes, that was costing them the most money, versus those people who did not have a disorder and who did not participate in the program. Their cost was exactly the same. So Memorial Mission said, we're going to take this program on. So we're going to look at diabetes, asthma, hypertension, and mental health. So here is the largest employer of Western North Carolina says, we're self-insured, we got reinsurance through a company, but it's costing us millions and millions of dollars to insure people. How can we lower our costs? That impacts our bottom line. The same thing that I think that the federal government should do. Because ultimately, you got one of two choices. You borrow the money from China, Japan, India, and other countries. To be quite frank, the way the Bush administration did for the last 8 years. They put us in a tremendous amount of debt. Greatest debt that we've seen in our nation's history ever. Borrowed more money than all the other presidents who have ever served before him combined. Put us deeper in debt. Or we start taking control of the costs and the expenses, encourage people to do that. Memorial Mission, their healthcare costs did this. When everybody else's in the country was going up, their cost was going down. This year, after this is their 5th year in the program, this is the first year that their health care has actually gone up a little bit. And when I said a little bit, it was like in a small single-digit %, when everybody else is going up 16, 17, 18%. Now, they made rules, they made exceptions to those who couldn't participate in the program. To me, those are the ways that we can curb the cost of health care and make sure that everybody's provided. And I would go to the extent of saying this, that we've got programs that are already in place. Medicare, Medicaid are already in place. So why would we have to recreate and restructure another bureaucracy that's going to cost us millions and millions and billions of dollars? That's the area in which we've got to make some significant changes.